ambulance chiefs are urging hospitals to admit more patients to be treated in corridors, arguing it's safer than leaving 999 callers suffering at home. It comes as 1 in 8 casualty patients now spends more than an hour waiting outside the hospital as emergency vehicles back out. In some extreme cases, delays of more than 10 hours have been reported. The target time is just 15 minutes. And in more worrying news for Britain's health, figures have revealed 800,000 patients were admitted to hospital with nutritional deficiencies last year, 3 times more than a decade ago. It's feared that poverty and subsequent poor diet are leading to surging cases of vitamin and iron deficiencies as well as nutrition. On the ambulance front, with people actually being taken to hospital and treated in the corridors, I understand the optics of it is terrible. There's overcrowded hospitals with people being treated on beds if they can get in beds, or if they're lying on the floor or on chairs or whatever. I understand the optics are terrible, and it really paints this picture of a crumbling Britain and a crumbling health service. But I do get the logic here, and I actually support it, because it's much better than someone being at home, not being seen by any medical professionals. You can't actually see physically
where would you prefer to be having a heart attack? On the kitchen floor or in a hospital
someone
corridor?
having an asthma attack, for instance. And, it's happened to me where I've had to call 999, and just the state of waiting there, you don't know how long you're going to wait and all of that. So I understand the optics of that are terrible, but I do think it's necessary. But this should highlight the need for more resources, because then that brings on the secondary question of, yes, they are in the corridor and somehow they get care or the emergency doesn't escalate. But it's like, who's going to record the data that you need for their file, for future reference, for other medical professionals to see them? These are all things that could easily be missed if you're in the frenzy of having to treat people with an emergency in the corridors. On the sort of malnutrition front, I do think that this is a symptom of the fact that a lot of our food is calorie rich but nutrition poor. So you can actually now eat food and feel full, but you're not cognizant of the fact that you're eating foods that are depriving you or not sufficiently, don't have sufficient nutrients that you need. So you have people having to take supplements or really having to think, actually, what vitamins and minerals do I need on a daily basis, and what kinds of food do I need to sustain that? If you're time poor, if you don't regularly cook, if you eat fast food, if you eat out a lot, you don't really think about these things. And I think that's actually what we're seeing now.
But also, I think we should be aware that malnutrition is also something that old people turn up a lot with.
Exactly.
And I think that's more to do with, this sort of breakdown in society, the fact that often old people are just left alone and don't really have family or friends nearby checking that they're eating.
Absolutely.
How often, when you're phoning up your surgery and it's taking a while for the operator, who's not in the surgery but somewhere else, telling you, if you're in real trouble, don't forget to head off to your accident and emergency. Can we not come up with a surgery that actually is a sort of hybrid between accident and emergency hospital and a doctor's surgery? I say this because I saw a surgery which was built about 4 or 5 years ago, which looks like a mini hospital where people can be treated in there, that the surgery can be a little bit more than a sort of 8:30 through 6:30, and to stop piling pressure on accident and an emergency.
I think that's a really good point, though, about A&E, because A&E is sort of being treated like a doctor's surgery because of the shortage of supply of GPs. We've also got, and I agree with you also about the optics of it, but how have we got to this state? It's really disturbing that we don't have enough capacity. But then also, we've got this situation where to have resources just sat there waiting outside. So what we're talking about is people lying in ambulances and various other things, or then just being sort of put there just to sit rather than necessarily being treated, when they've got the staff and not pushing people through and working out what's really important and what isn't. But then also, I think that this is partly also because healthcare has evolved. We should be using everything available to us, not to save money, but so we should be using online for stuff where we kind of know what's wrong, see somebody immediately, you can do it online, is it urgent? Gets into somebody where you could do with seeing somebody quite quickly, you cut your finger, it's not life and death, and then things which are life and death, and make sure that all these things are delivered. And it seems common sense has not been applied to the resources that we have. And when it comes to the eating and the disorders and the, malnutrition, of course, some of it is genuine poverty, and some of it is just lack of education.
I would actually say most of it is
also social.
Sorry, I was going to say there's also an argument here for paying our staff in hospitals doctors and nurses better so that, number one, they're not always in strike. Number two, we can retain people in health service and also attract people into joining the health service in the first place. So you don't have this situation where you're sitting in an ambulance bay for an hour waiting to be admitted. But I do agree, like, it would be better for you to be in a hospital setting rather than at home. Like you said, would you rather be having a heart attack on your kitchen floor or in a hospital corridor? Well, definitely. And but if they've got the staff.
I think this is also about the breakdown of health and social care. So we've got old people that can't be discharged because they would be discharged to go home alone. Yeah. Also, when you go into A&E, you often see maybe homeless people, people who are drunk and have been taken in.
Yeah.
That's the problem. That's not... Homeless people don't need to be there if they're I don't know, undergoing addiction issues, things like that. That's because we don't have a functioning health and social care system. We just have our emergency hospital healthcare treatment. And so you get a pressure on there.